Welcome to the Washington Health Benefit Exchange's 2017 Healthplanfinder Security Training. You may be joining us for one of two reasons. Many of you are here to complete your mandatory annual security refresher training to continue your volunteer access in Healthplanfinder. Others are taking this training as part of the 6th and final training module in becoming a volunteer assister to receive access to assist individuals with applying and renewing their Apple Health coverage in the Washington Healthplanfinder web portal at www.wahealthplanfinder.org. At the end of today's lesson, we'll share the final steps in how to become a volunteer assister with access to Washington Healthplanfinder. As we discussed in the previous modules, community partners with Healthplanfinder access have a number of benefits available to them to assist individuals and families with Apple Health coverage. To apply for access, community partners must be affiliated with an organization. We'll talk more about this towards the end of today's presentation. The purpose of this training is to provide you with an annual overview of security and privacy practices, to prepare a baseline of security awareness for working with the Washington Health Benefit Exchange's Healthplanfinder web portal, and to increase user awareness and improve user behavior. Who is responsible for protecting personal information? Everyone who becomes a volunteer assister with access in Healthplanfinder and users of information technology systems is equally responsible for security and privacy. You are responsible for the information you handle every day. It's everyone's responsibility to keep our systems and information secure. No one is exempt. There are several types of security risks, including email phishing, which is the attempt to acquire sensitive information such as usernames, passwords, or other personal information, often for malicious reasons, by pretending to be a trustworthy entity in an email or other electronic communication. Shoulder surfing employees or colleagues who come by your computer when you're working and look over your shoulder, weak passwords which we'll go into detail about later, unauthorized access to the Healthplanfinder, misrouted or unsecure emails that contain personal information, and oversharing information are also risks. What is PII? Personally identifiable information. This is a term we'll use a lot when discussing security and privacy. Examples of this include name, date of birth, social security numbers, addresses, and contact information. There are a lot of pieces of information collected and processed through the Washington Healthplanfinder. This slide shows a snapshot of the information you are responsible for one individual and all of the avenues the information either comes from or is sent through. Please take a moment to read through them. Press pause if necessary. When dealing with this information in these sources, it is extremely important to practice safeguarding methods, which we'll talk about momentarily. Unauthorized disclosure of PII has several possible consequences, including employee discipline or termination, large fines up to $25,000 per person or entity, and even criminal charges in some cases. Passwords that are easy to guess are not very effective for protecting information. Here are tips for avoiding these weak passwords. The next slide discusses some ways to make stronger passwords that are more difficult for someone trying to gain unauthorized access to the Healthplanfinder. If you include each of these elements, you'll have a strong password that is not easy to guess by intruders. Try using a passphrase like explained in this slide so you can easily remember it without having to write it down. Here are some security tips for you to keep in mind in your daily work. Use OneDrive or an online drive that can store your files if you can, instead of storing information on your computer where it can be easily accessed if someone steals or has unauthorized access to it. Do not share your passwords with anyone, not even your supervisor, and don't write them down anywhere, especially on a sticky note next to your computer. Keep your desk clean by discarding all notes you take during the day that might have PII on them. And of course, please don't discuss any PII on social sites, even if they are owned by your organization or the Health Benefit Exchange. And last but not least, erase any confidential information on whiteboards and clean up meeting rooms after you are done. Here's a further list of security tips you can follow to make sure you are not in jeopardy of causing an incident. Practice the need to know rule of thumb and do not discuss any personal or confidential information on a case with someone who does not have need to know. Log out of Healthplanfinder before closing your browser window. Protect your computer and devices in case an unauthorized individual gets a hold of them. You can lock your computer on Windows by pressing the Windows button and the L key at the same time. Use a cable lock and lock your laptops to your desk. Use a secure method for sending emails with sensitive information. And know who to contact in case of a security question or incident. An incident means the act of violating a security policy. Examples include accidentally sending an email or report containing PII to a person not authorized to view it or sending it in an unprotected manner, allowing an unauthorized person to use your computer or log in to access PII, discussing work-related information in a public area or on a social media site, accessing the private records of friends, neighbors, celebrities, or any other person when not authorized to do so, and also any security situation that could compromise PII, such as virus or email phishing scams. A breach happens when there is a loss of control. A good example of a breach happened in the state of Minnesota in September 2013 prior to Go Live, when an employee attached an Excel workbook to the wrong email distribution list and lost control of broker data, including broker license numbers, names, and addresses. Now let's go over how to prevent an incident. Take precautions for preventing incidents from happening. Remember, what you see, hear, and know is confidential. Only discuss confidential information with personnel on a need-to-know basis. Use your shredder bins at work to discard confidential information. Lock your computers when you step away from your desk, even if it's for a few seconds. Discard post-it notes and scrap paper you use to write down confidential information. Follow these guidelines and any security measures you have in your place of work at all times. If you become aware of an incident, contact your Healthplanfinder volunteer sister point of contact immediately. Your HCA contact for Healthplanfinder volunteer sisters can be reached via email at hcavolunteersister@hca.wa.gov. For community partners, Healthcare Authority has made available a team of eligibility policy representatives to provide assistance for questions regarding Medicaid eligibility and assistance with Washington Apple Health applications in Healthplanfinder. These representatives serve specific counties. Please find your county on this list. That HCA Area Representative will be available to answer your questions. So finally, for those applying to receive Healthcare Authority Community Partner Volunteers Assister Access in Healthplanfinder, you must complete all 6 modules of the community-based training, be affiliated with an organization, request a training assessment test at HCA Volunteer Sister at hca.wa.gov, and complete and return the test to the same email address. Once Healthcare Authority determines successful completion of the test, Healthcare Authority will email the volunteer access registration packet, including a community partner registration form, Washington State Patrol background check, and Washington Health Benefit Exchange user agreement. Once approved, Healthcare Authority will notify you via email. You will then be granted access in Healthplanfinder and sent a personal username and password. As a reminder, if there has been no activity on your Healthplanfinder account in 180 days, your access will be disabled. Also, passwords for Healthplanfinder expire every 60 days. For more resources and training materials regarding Apple Health Medicaid and the use of Healthplanfinder, please visit the Healthcare Authority Training and Education webpage at the link shown on this slide. For more information about the Washington Health Benefit Exchange, you can visit www.wahbexchange.org. Congratulations! You have completed the annual requirement for Health Benefit Exchange's Healthplanfinder security training. If you are applying to become an HCA volunteer assister, please contact Healthcare Authority at HCA Volunteer Assister at hca.wa.gov to receive the final steps needed to obtain access in Healthplanfinder.